Hi viewers, I am Dr. Anand Jadhav. I am a senior consultant and head of orthopedic services at Manipal Hospital Baner, Pune. Today I am going to talk about recurrent shoulder dislocations. Shoulder dislocation is a common problem. 90% of the time the shoulder will dislocate in the front, which is called as the anterior shoulder dislocation. 10% of the time it dislocates in the back, which is called the posterior shoulder dislocation. When a patient starts to repeatedly dislocate his shoulder, certain features happen in the shoulder. Number one, the stabilizing ring which is there around the socket that gets detached from its original position. The capsule of the shoulder joint becomes very loose. When the shoulder dislocates, the head hits against the rim of the socket, so it gets a defect which is called as a Hill-Sachs lesion. So we do clinical assessment of the patient, get an MRI scan done, and also get a CT scan done. Now these three investigations tell us how much damage has happened to the shoulder, what is the status of the glenoid socket, which is the socket, any erosion or wearing of the front of the socket, and also the depth and the extent of the defect on the ball side. We stabilize such shoulders through arthroscopic mechanism, which are keyhole surgeries. There are two portals in the front and one at the back. We go and clean up the tissues. We put anchors on the socket side and bring the labrum, which is the stabilizing ring, from its unusual position to its normal position, and it's tied with suture anchors. These are not dissolving sutures. It gives us chance to retension the capsule of the shoulder joint. Now if unfortunately the defect on the ball side is big, then we have to perform an additional procedure on the ball side, which is called as a remplissage procedure. This leads to stabilization of the shoulder, and after about 6 months the patient can return to full active sports. In those people where the glenoid is very badly worn out, a different surgery is done wherein a piece of bone from the front of the shoulder and its attached ligaments is brought in and fixed to the front of the glenoid socket with help of screws. This increases the arc of the socket and prevents shoulder dislocation. So if you have any kind of shoulder problems, be it dislocation, pain in shoulder, frozen shoulder, or a torn rotator cuff, please visit us at Manipal Hospital Baner, where we will provide you with comprehensive shoulder services. Thank you.